Hi, everyone, and welcome back to Revenue Cycle Decoded. I'm your host, Gina Cornett. And today we are going to tackle a big question that is on the minds of many job seekers and professionals in the field of healthcare revenue cycle. And that is, will AI or artificial intelligence take over medical billing and coding? And what does it mean for revenue cycle jobs as a whole? With the rapid rise of AI and automation and machine learning, we are beginning to see more and more tasks that are being handled differently in healthcare. Routine processes like claims processing, data entry, and even initial billing reviews are increasingly being managed by AI. And so, what does that mean for humans in these roles? Are some jobs more likely to thrive or survive in an AI-driven world? In this video, I'm going to discuss how AI is changing medical billing and coding, the revenue cycle jobs that are likely to endure and even grow with AI, why these jobs are critical in healthcare organizations, and the skills that you need to future-proof your career. So let's dive in. Let's start with an overview of what AI is already doing in medical billing and coding. AI and machine learning have made huge strides in automating repetitive, data heavy tasks. Today's AI tools can process claims, identify coding errors, and even assist in denial management. They analyze massive data sets quickly. They can flag issues that would have taken humans hours to catch, and they can do this 24/7. And they offer a level of efficiency and consistency that's really hard to match. For example, AI-powered coding tools can scan medical records, apply billing codes, and even match claims to insurance requirements. And these capabilities have the capacity to really speed up revenue cycle processes and reduce human error in tasks that are often seen as repetitive and time-consuming. So, if AI can take over these tasks, what does that mean for human coders and billers? Are those roles going to go away completely? Well, not exactly. There's still a lot that AI can't do, especially because revenue cycle is really complex. And there are a lot of regulations and payer requirements and unique patient cases that cause constant variability and complexity. So that brings us to our main topic. What revenue cycle jobs are likely to survive or even thrive in the AI era? Let's go through them one by one. The first is revenue cycle analysts. Now, revenue cycle analysts are responsible for interpreting data and providing actionable insights to improve financial performance. And while AI can generate data and even identify patterns, the role of an AI analyst involves a much deeper level of understanding and strategic thinking. Analysts don't just look at the numbers. They understand the bigger picture. They connect the dots and they recommend strategies to improve the revenue cycle processes. So, in other words, while AI can crunch the data, it really takes a human to interpret it, recognize trends, and then make informed decisions based on the context. For example, an AI is not going to understand the intricacies of a particular hospital system or the exact environment in which it's operating. So it would take a revenue cycle analyst that is human to be able to apply those particular environmental and cultural um, items to their analysis when making recommendations. So if you're in an analyst role, focus on building skills like data interpretation, trend analysis, and strategic planning, but also really focus on understanding the organization and its culture for which you are creating the analysis. Analysts who know how to interpret AI-generated data or even AI-reviewed data and crunched data, and then turn it into actionable, relevant strategies that are tailored for the particular organization will really be in demand, even as AI becomes more prevalent. The next role is denial management specialists. Denial management is really one of the most complex areas in revenue cycle management. AI can flag denials and it can suggest initial steps to resolve them. It can even write appeal letters and submit those to the payers along with all of the supporting information from regulations and policies, but it can't handle the complete and full complexity of the appeal process and payer policies and regulatory changes. It's only going to be as good as the information that it has. And as we know, data is always changing. And it takes denial management specialists to understand those specific policies and regulations and be able to apply them in what can sometimes be very challenging and individualized cases. So, denial management specialists bring a deep understanding of both coding and payer requirements, and they use this knowledge to navigate denials, appeal claims, and then work with payers directly to secure payment. A denial might be flagged for a coding error or a lack of documentation, but a denial management specialist would not only correct the issue, but also look for patterns in the denials to try to prevent future occurrences. And then work directly with clinicians and coding teams to improve their documentation and compliance so that we ensure smoother processing down the line and the denials don't reoccur. So, if you're in denial management or this is a field that you're interested in, focus on enhancing your negotiation skills, your payer policy knowledge, and your compliance expertise. While AI might help to streamline pieces and parts of the denial process, complex cases are still going to require the judgment and the persistence that only a human specialist can bring. Another role for humans is patient financial counselors. As healthcare costs continue to rise, patient financial counselors have become essential for many healthcare organizations. AI might help with generating cost estimates or automate payment options. But when it comes to discussing financial matters with patients, the human touch is irreplaceable. Patients need empathy and guidance and personalized support to navigate their financial responsibilities. And let's face it, they want to talk to a human. Patient financial counselors help patients understand their bills, they explain their insurance coverage, and they work out payment plans that will meet their patients' needs. They are on the front lines of patient experience, and the role requires strong communication skills and empathy that AI just can't replicate. So, if you are interested in patient financial counseling or this is your current job role, focus on building communication skills, financial literacy, and empathy. Counselors who can connect with patients and provide personal support are indispensable, even in AI driven healthcare systems. The next role is compliance and regulatory specialists. Healthcare regulations are constantly evolving, and compliance specialists ensure that organizations meet all of the state and federal requirements. AI can help with compliance monitoring. It can flag potential issues, but it can't interpret new laws or adjust policies or navigate the nuances of healthcare regulations. Compliance requires judgment and adaptability and the ability to interpret complex legal language. And trust me, when you are working in compliance, sometimes the placement of a word or a comma or a period can mean all the difference in what a regulation or a policy means. So these are areas where human expertise is really crucial. So to thrive in compliance, develop skills in policy interpretation, regulatory updates, and healthcare law. As AI takes on more administrative tasks, compliance specialists will play a vital role in translating regulations into actionable policies. Now, let's talk about revenue cycle managers and directors. AI can streamline tasks, but it can't replace leadership and strategic thinking and planning that revenue cycle managers and directors provide. These roles involve overseeing the entire revenue cycle process, coordinating teams, and setting strategies to improve collections, efficiency, and compliance. Revenue cycle managers understand every part of the revenue cycle from patient access to collections, and they're responsible for ensuring that everything and everyone aligns with the organization's goals. So while AI can assist with specific tasks, it is the manager's job to bring it all together and make decisions to support the bigger picture. So if you are or you plan to be a revenue cycle manager or director, focus on leadership, cross-departmental communication, and strategic planning. Managers who understand how to integrate AI tools within their teams can use them to help them drive strategic goals. Next, let's talk about patient access coordinators, or you may know them as the front desk folks. Patient access coordinators handle everything from scheduling appointments to verifying insurance and managing pre authorizations. AI can assist with all of those tasks, but there is still a strong need for human oversight to ensure accuracy and to provide a positive patient experience. Now, we've been in offices where you can do all of the check in and registration without ever having to see a human, but most patients still like to see a human at the front desk, especially with our aging population. They like to see somebody friendly, smiling face at the front desk who is going to help them navigate their scheduling and their registration, as well as helping to educate them on their insurance. So while AI can assist, we still need that human touch. Patient access coordinators also address complex insurance questions, and they help patients to understand their financial responsibilities. So, if you are interested in a patient access role, or you are a patient access coordinator or a front office coordinator, focus on customer service, insurance knowledge, and organizational skills. AI can handle the routine task, but it cannot handle the people part of this role. And coordinators can balance efficiency with empathy and continue to maintain that vital role in patient experience. Now, let's talk about clinical documentation improvement. These specialists are often clinicians who work with other clinicians or physicians to help them improve their documentation, both as a means of communicating with other clinical specialists or clinicians within their organization or outside their organization, but also to support their billing, their coding, and to audit proof their documentation. So in this role, human touch is vitally important. Physicians and providers don't want to be educated by an AI popping up in their documentation saying, hey, did you remember to document this or that? It really helps to have a human person to help the providers, physicians, clinicians understand the vital role of their documentation and what is required according to policy or regulation and the why, because these clinical documentation improvement specialists can really help the providers and clinicians to streamline their notes, to make their notes more effective, to help them improve their efficiency in documentation, and to help them understand why it's important to document specific elements to ensure that they are communicating what they need to communicate to other clinicians and to potential auditors and payers. So this is a vital human role where that human touch from one person to another is really, really important. If this is a role that you are interested in or you are currently in, of course, focus on understanding regulations and policies, and your communication skills. So, if you're a revenue cycle professional or you are a job seeker looking for a revenue cycle job and you're thinking about the future and perhaps fearing it, the takeaway is clear. AI is changing the landscape, and there are roles that are going to diminish or go away or be taken over by AI. And there's no getting around it. When automobiles were invented, they replaced horse and buggy, right? But it created whole new industries. And the same thing is going to happen in revenue cycle. So while routine medical coding and billing jobs may decrease, there are going to be jobs available. And many of those jobs are going to be in revenue cycle because it does require that additional complexity and that human touch. So focus on jobs that are going to require critical thinking and empathy and strategic decision making because these are going to remain essential. To stay competitive, build skills that are uniquely human, like compliance knowledge, data interpretation, and effective communication. The more you bring these skills to the table, the more valuable you will be as AI takes over routine tasks. If you are interested in a revenue cycle career and you would like to learn more, please check out my course, Revenue Cycle Bootcamp, on revenuecycledecoded.com. So thanks so much for watching. If you found this video helpful, please like, subscribe, and let me know in the comments. Do you think AI will eventually replace medical billing and coding entirely? Or do you believe human skills will keep those roles alive? I'd love to hear your perspective. And remember, the best way to secure a career in an AI-driven world is to focus on the skills that make you irreplaceable. See you next time. Peace out.